Mobility After CVA, a presentation available for skilled nursing facility staff who wants to learn how to help patients who have suffered from a CVA with mobility. So things that I would say would first be needed to know. Strokes can affect people in many different aspects. Some of the ways that it will affect mobility is the way that some people sit, walk, maintain their balance, and most importantly, it will affect completion of the ADLs and IADL activities through the mobility deficits. A CVA can affect mobility in ways such as weakness, planning and coordination problems, muscle changes, balance, changes in sensation, swelling, fatigue, and pain. For weakness, this can show up in the forms of hemiplegia, which is a paralysis, or hemiparesis, which is weakness, and this is going to typically just affect one side of the body. With stroke victims, we know that if it happened on the left side of the brain, it's going to affect the right side of the body, and it'll be the opposite for the opposite. So this is going to affect a number of different issues. The weakness kind of falls into the rest of the categories. So for planning and coordinating problems, they can suffer from apraxia, which is going to be the difficulty in planning leg movements, and then ataxia also will result in slow, clumsy movement of the body. So this is going to be an effect from the weakness, and it's going to affect the patient's ability to move comfortably and in fluid motions. Muscle changes. The hypertonicity and spasticity is going to cause the muscles to stiffen and become very tight. And the hypotonicity is going to cause the muscles to become very loose, almost flaccid. So it's going to make it difficult for the patient to have any kind of control over their motions and movements. And especially with the spasticity and hypertonicity, this can be difficult when affecting the patient's ability to extend their arms and complete any kind of tasks. For balance is going to be a very common denominator as a result of the number of different things we've talked about, but it will also cause some dizziness and unsteadiness and difficulty in maintaining balance. Obviously, if somebody's suffering from hemiplegia or hemiparesis, it's going to be quite difficult to maintain balance with one side of the body, suffering from, weakness or paralysis. Changes in sensation. People who have had a CVA will have the terrible, terrible feeling of the pins and needles. That feeling when your foot is falling asleep is the most annoying feeling in the world. So this is a sensation that they feel often in their body. They may lose feeling completely in some of their limbs, and they also will experience some hypersensitivity. So things that don't maybe bother them before their stroke will become extremely, extremely sensitive after they've experienced the stroke. Sorry about that. So swelling is going to be a big factor, especially they'll suffer from edema, especially if there's little to no movement in the leg, feet, or hands or arms. So keeping good range of motion and constant motion as best as they can will help to reduce the likelihood of edema, but it is a kind of issue that can be faced after having a CVA. Fatigue. Completing even simple tasks will become tiring due to the hemiplegia or hemiparesis that they're going to have after their CVA. Overall endurance is going to be difficult for them to maintain, and it's going to overall just affect their abilities to complete their tasks. Pain. Unfortunately, due to all of the things we've talked about previously, it is going to be common for somebody after having a CVA to experience some pain. They talked specifically in a study from a stroke organization about the effects strokes can have on the legs, specifically on the hips. So with all of these different client factors, this is going to increase the risk for falls. This is going to make it necessary to take proper precautions to avoid any increased risk of falling. So different risk precautions that can be taken are having the clients or patients wear comfortable, supportive shoes, avoid them wearing any kind of slippers or walking around in socks, using adaptive equipment as needed, such as walkers, canes, or wheelchairs, removing any safety hazards such as loose cords, rugs, or other recommendations given from the occupational therapist in their living quarters. So, talking about the adaptive equipment, the walker. Patients that have had a CVA may have use of both of their arms and legs, but they could also still experience some balance problems due to the weakness. If this is the case, a rolling walker is going to be utilized and will be very beneficial in their recovery. For a cane, there are a couple different kinds of canes. So hemi walkers and quad canes are going to be for people who've survived the CVA but may have the paralysis or the hemiparesis. And the hemi walker or quad cane is beneficial because it has a wider base and offers more support than your typical single-tipped cane. The single-tipped cane still offers support, it's just minimal support, and it's going to be for patients that aren't suffering from quite as much weakness or, the plegia or paresis. And for wheelchairs and scooters, these are going to be for the CVA victims who do need a wheelchair due to very limited mobility. If the patient's unable to get around in a wheelchair, there are electric wheelchairs and scooters available that will be operated by one hand. These are the resources that I used, and this is just going to be beneficial for anybody that is working with a CVA patient. Thanks so much.